Behavioral health is a clinical service that helps people who are suffering from both mental illness and addiction disorders. The prevalence of illness in Tampa Bay is quite high. 1 in 5 adults, 1 in 10 children suffer from these disorders and need treatment. In our past 3 years with this pandemic, the need has increased. In particular, we have 2 patient populations that have suffered greatly. One is people who struggle with addiction became much more involved with their drugs of choice. The children are the second group. Immediately when the pandemic happened, the schools all went home and they lost their friends and their families got concerned about who was going to care for them, and parents left their jobs and the homes became very unstable because of that. So the disruption in their lives has created a lot of unmet need with the children. The social connectivity that these kids lost is the biggest impact on their lives. When we talk about kids, we really need to be talking about their parents, because they're in uncharted territory as well. They don't know how to deal with these new behaviors and these new concerns that the kids are surfacing. 1/4 of all of our hospital discharges throughout Baycare have a comorbid mental health or substance use problem. If we ignore these issues, the outcomes of our medical patients will not be as good as they are now, especially with our patients who have chronic illnesses. The community plays a role in developing the right treatment system. Without the community, there'd be a lot of holes. But right now, I think our communities are very focused on this area. So it's our job to come up with the next creative pilot that fills that gap. So it takes, and when I say it takes a village, it's so true. It's the community, it's the hospital systems, and it's the state that have to all work together to make it work for people who suffer from this illness. The St. Joe North Unit, wow. Talk about a great adventure. We're building our St. Joe unit to be what we call a psychiatric medical unit, where both their medical and their psychiatric needs can be done at the same time in an environment that is created especially for it. So that has been a need that has been growing, certainly in the Baycare health system and in Tampa Bay for many years. So these beds are going to be very highly sought after, and we're very excited to open that program. So we are growing both in the south part of Hillsborough and up into the Plant City area. So we're going to be going to the communities that we know just don't have the transportation capacity or the services that they need. It is very unusual for a health system to value everyone's emotional health the way that they value their medical health. Baycare has a commitment to make sure the whole person gets cared for, and we have seen it front and center during this pandemic. People aren't going to get better if they don't think that they can. People aren't going to seek out someone to talk to if we don't encourage them to. So we have that going on all throughout Baycare. Your mental health is as important as your physical health.